आजचा टॉपिक आहे की गेल्या 4 वर्षामध्ये आपण केलेलं म्हणजे कार्य आणि इंटरेस्टेड केसेस. सो टू स्टार्ट विथ ॲज वी नो एक्सरे वॉज डिस्कवर्ड बाय द रोएंटजन अँड दिस इज द फर्स्ट एक्सरे रेडिओग्राफर. आणि हा एक्सरे त्यांच्या वाईफचा होता. इट वॉज टेकन इन 1895. सो आपल्याकडे लेटेस्ट म्हणजे डिजिटल एक्सरेज 2 मशीन आहेत. 500 mAचं मशीन आहे आणि 100 mAचं पण मशीन आहे. In case any technical issue we get, we have a second option, and we are doing number of मतलब TB स्क्रीनिंग एक्सरेज अँड ऑल जसं मी सांगितलं. आणि हजारो एक्सरेज आपण कोविडच्या टाईममध्ये आपण ह्याच मशीनवरती आपण केलेलं आहोत. आणि जेव्हा मी मुखेडला आलो तेव्हाच मी डिसाईड केलं होतं की आपल्याला CT स्कॅन पण आणायचं आहे आणि त्याच्या कम्पॅटिबलच आपण प्रिंटर पण ऑलरेडी तेव्हाच घेतलं होतं. अँड हे नॉर्मल एक्सरे आहे. आता मी डायरेक्ट थोडं फास्टमध्ये दाखवेन. हे क्लासिक केस आहे, मॅसिव्ह प्लुरल इफ्युजन. लेफ्ट साईडचं प्लुरल इफ्युजनची केस आहे, ट्रकिया शिफ्ट झालेला आहे. हे निमोथोरॅक्सची केस आहे, राईट साईडेड निमोथोरॅक्स. ह्या केसमध्ये आपल्याला बघायला मिळतं की कोलॅप्स, राईट साईडेड कोलॅप्स आहे आणि ट्रकेल शिफ्ट जे दिसते आपल्याला राईट साईडलाच आहे. सो दिस इज अ लंग कोलॅप्स. दिस इज कन्सोलिडेशन, म्हणजे तुम्हाला जी ही ओपेसिटी दिसते लार्ज, हे कन्सोलिडेशन आहे. ही केस आहे सोलिटरी मास, म्हणजे लंग मास असा दिसतो. आपण CT स्कॅन सेम पेशंटचं केलेलं आहे. CT स्कॅनची पण केस मी दाखवेन लगेच. हे लंग मेट्स आहेत, कॅनॉन बॉल मेट्स म्हणतो आपण, आणि लंग मेटास्टेसिस एक्सरेमध्ये असं दिसतं. आणि ही वाली जे ॲरो आपण पॉईंट आउट केलेलं आहे दॅट इज अ अपसेस लंग कॅव्हिटेटरी लिजन. ही क्लासिक केस आहे पल्मोनरी एडेमाची. याच्यामध्ये आपल्याला क्लासिक बॅडविंग अपिअरन्स बघायला मिळतं. देर इज ओबेसिटीज इन बायलॅटरल हायलर रिजन अँड दिस साइन इज नोन ॲज अ बॅडविंग साइन अँड दिस इज अ बॅडविंग अपिअरन्स. So this is also a classic case, hydropneumothorax. There is a homogeneous opacity right lower lobe with a fluid level, and this is a case of hydropneumothorax. इथं आपल्याला निमोथोरॅक्स आपण का म्हणतोय तर इथं आपल्याला वस्क्युलर मार्किंग्स दिसत नाही आहेत. अँड दिस इज अ फ्रॅक्चर क्लॅव्हिकल केस, मल्टिपल रिब फ्रॅक्चर्स अँड कार्डिओमेगॅली केस. आपण कार्डिओमेगॅली एक्सरेवरती चेस्ट एक्सरे PAV आपण डायग्नोस करतो. अँड दिस इज व्हेरी इम्पॉर्टंट एक्सरे वेअर वी डिपिक्ट गॅस अंडर डोम ऑफ डायफ्राम दॅट इज नोन ॲज निमोपेरिटोनियम. अँड दिस इज अ बेअर एमर्जन्सी परफोरेशन. दिस इज निमोपेरिटोनियम. So pediatric X-ray, we have to remember 2 things. This is normal X-ray. This should not be labeled as an abnormal X-ray, whereas this is a abnormal X-ray. There is a very little difference. This is normal cell sign, and where this sign is also known as spinnaker cell sign, and this is associated with pneumomediastinum. This is the line which is different from this. This is a classic cell sign. And one more X-ray I will like to show. This is a newborn with tetralogy of Fallot. This is a classic sign of boot shape heart. Very good. Yes, tough boot shape heart. And this is egg on side appearance, that is TGA, transposition of great arteries. So this is a case of pneumonia, round pneumonia. Our pediatricians on daily practice they encounter. This is a round pneumonia case, and post antibiotic treatment this pneumonia has absolutely got resolved after antibiotic treatment. So coming to the dental x-rays, to get one dental x-ray, people supposed to suffer. They all the way they were traveling to the NANDED, and I found that we should have a dental x-ray, and we are having the latest dental x-ray digital machine with us, extra fun. And the advantages of the dental machine, it shows the entire dentition in single image. And it is useful in patient with trismus and gagging problems, relatively low radiation dose. So we can see the entire teeth in one image, and this is the X-ray which was taken in Aadhya Diagnostic Center. We can see the impacted teeth on both sides. So also in the dental X-ray we can see the OKC. This is odontogenic keratogenic cyst. OKC on involving the mandible body on the left side. Also, we can find out the various fractures. So this is a fracture which is seen involving up to the root of the teeth. So there is a teeth fracture as well, and this is a transverse fracture, mandible angle on the left. So coming to the ultrasounds, we have the latest machine, the E6. This is an expert series. This is Voluson E6 machine on which I do 3D, 4D and 5D scans, which is exclusively for NT and TIFA scans. And this is the today's machine, Logic P9, which is also a 3D compatible machine, and on this machine I can do both Dopplers, the peripheral Dopplers on all kinds of soft tissues, abdomens and all. Today only we have inaugurated this. And one more machine I'm having, this is the Logic P6 Pro. And how the gallbladder stone looks on ultrasound. This is the gallbladder. The black looks, this black which looks, that is a bile, and these are the stones within the gallbladder, 1, 2, 3 stones. So DVT is an emergency. On day-to-day practice, Dr. Kaur sir, Punde sir and respective Patwar sir, they do refer cases. This is a normal vessels, these two vessels. This is artery, this is vein. Artery is normal. In vein, we can see there is a thrombus within the lumen, and on Doppler there is no flow. This is normal vessel, whereas in DVT we see no color on Doppler. So nowadays summer is there and various renal stones patients are coming, and we do give reports of renal calcium concretions. This is a pre-stage of calculi and nothing to worry. Just the causes are dehydration, thyroid dysfunction, obesity, gastric bypass surgery. These are the some issues. Only the thing is the treatment is nutritious diet and daily 3 to 4 liters of water intake. Drink regular 3-4 liters of water and avoid the junk food which are high in salt and oxalate. So coming to the non-specific adenitis, on day-to-day X-rays, most of the children they present with abdominal pain, and mesenteric adenitis non-specific is nothing to worry, but when they enlarge mesenteric adenitis, they tend to get a intussusception. Those are the transient points. That is a triggering point, and intussusception I will show the case. And for non-specific nodes also no treatment is there, just reassurance, then rehydration and the mild painkillers. So coming to the CT machine, we have the latest CT machine in our setup, and as I told, today we have successfully completed 1 year, and whatever the cases I have done in last 1 year, that was like charity basis or at reasonable cost, and I have convinced patients, I have convinced all our respected doctors, and respected doctors' support were persistently there, and it was possible because of them, and we have successfully achieved 1000 CT scans in 1 year, and out of that 70 cancer patients we have detected and various abnormalities. All 90% of the CT scans were abnormal. Only we do whatever whenever we have a doubt of suspicion. So how the CT of the normal CT brain looks. So there are two important things. This patient, right side, he came with right-sided weakness, accelerated hypertension. There is a infarct. How infarct looks on CT scan? This is hypodense area, means this black entire area which is involving the left middle cerebral artery territory. This is a large MCA infarct, and we need to differentiate between the infarct and the bleed. So this is a case of intraparenchymal bleed. So blood looks white and the infarct or the stroke which looks black on the CT scan. This you have to remember. And in this case, the blood intraparenchymal, the blood which is seen extending into the ventricle also. So this is known as intraparenchymal hemorrhage, which is involved extending up to the ventricle, known as intraventricular extension. This is a case, a baby presented with huge swelling of the head, and the X-ray shows there is an enlargement of head only, and the CT is very useful. In this case, the hydrocephalus, this entire black stuff is water, that is hydrocephalus. Dilated bilateral lateral ventricles, gross dilatation is there. This is known as hydrocephalus. So as in 2020 only I have booked CT machine, but there were some reasons I got delayed, and we have seen number of corona patients. COVID looks like this. There are multiple ground glass opacities involving the both lungs, which is also seen in bacterial pneumonia also. But there are some key differentiating points, and this is a classic pattern involvement of bilateral lower lobes, and this is known as ground glass opacities, which is seen in COVID corona patients. So coming to the interesting cases, I will discuss very few cases as we are running out of time. So this guy, he came, 70-year-old grandpa, he came with abdominal pain. Then actually he came for ultrasound. Then I screened him, chest X-ray, which is showing the marker is correct on right. The arch of aorta is on right side, and if you appreciate, the stomach bubble is also on right side. Yes. So ultrasound. This is a Ahmedabad sir machine, Dr. Tushar sir machine. It is Logic P6 Pro. On this machine, I have diagnosed this case. The spleen was on right, the liver was on left, and the gallbladder was also on left. So this was a complete mirror image dextrocardia with situs inversus totalis. So during these 4 years, I have diagnosed such 2 cases. This girl, she came from SDH for X-ray. Then I asked my fellow, she came for only one view, but we have taken 2 views as this is a rarest of the rare case. In this case, we can see the skull looks abnormal. There is enlargement of skull, nasal bone is absent, and there is abnormality in the fontanelle also, which will be better appreciated in AP view. Coming to the AP view, in this case, we can see the fontanelles are open. The anterior fontanelle is open, and we can appreciate there are no clavicles on both sides. The clavicles are either absent totally or hypoplastic, and we can appreciate the cervical rib on left hand side. So this was entire the findings, like she was having the open anterior fontanelle, bilateral absent clavicles, bone density was normal, the dysmorphic skull, wide anterior fontanelle, partial metopic suture, prominent coronal suture, bilateral absent or hypoplastic clavicles, hypoplasia bar absent nasal bone, left cervical rib. So these all were fitting in the CCD, that is known as cleidocranial dysostosis, classically known as Apert syndrome. So this is a example. This is a usefulness of the 3D. We can see the obvious cleft lip. So cleft lip, the chances of missing cleft lip on ultrasound, the unilateral cleft lip are 20%, and cleft palate missing on ultrasound is 40%. But with the advancement on 3D 4D, we are able to pick cleft lip 100%, and cleft palate there are indirect signs. And in 4 years I have not missed any cleft palate, and but still the imaging we may miss isolated cleft palate, which is difficult to diagnose. Coming to the another interesting case, this is a hemivertebra. Usually this is coronal image. All the vertebral bodies should be in line, like railroad appearance or string of pearl sign. But in this case, there is a hemivertebra, there is a break. So which is also a rare case. One 19-year girl, she came to my OPD with just epigastric pain. Usually we have single gallbladder. This is a case of another rare case of duplication of the gallbladder. We can see this is one, and this is the second gallbladder, which is minimally distended, and this I have diagnosed in 2020 itself. So this is a case of duplication of gallbladder. So TIFA scan, this is a classic case of we can appreciate this is the spine. So spine is definitely, it is abnormal. There is spina bifida, myelomeningocele, and deformed spine. And we can see the spine should come like this, but the spine all the way it is deformed. There is an abnormality which is depicted on the 3D 4D scan. And this is classic of lemon shaped skull with hydrocephalus. This black entire stuff is a water, that is hydrocephalus. Both ventricles are grossly dilated, and the shape of the skull, it has like lemon shape. This is a 3D 4D image of the same patient, and the bachu was having the bilateral club foot as well. We can see the foot, the both foot, in fact there were club foots. And another very interesting case, and the rare case which was referred by Dr. Aarti Patil ma'am, the femur. Here we can appreciate this is one femur, on other side the femur is short. So whenever I screen, I do compare with both sides as it is helpful, and I have measured one femur is coming 3.8 centimeter and other femur is coming 3.3 centimeter. Then this baby also had the bilateral club foot. The right this is the right kidney, okay, and the adrenal gland in this case. In this case, the one kidney was not seen and the flat lying down adrenal sign was positive. And there was also a suprarenal lesion as well. So, and this lesion was getting an arterial supply, the supply from aorta, and so this was a multiple anomalies, and this was a sequestration. So these multiple anomalies were the associated syndromic baby it was. And this is a gynae case, a 55-year female with pain abdomen, RIF and pelvis on the right side. We can see there is a large lesion with multiple internal like echogenic foci within, which is a classical of a dermoid cyst or teratoma. So we have a latest like MRI is there for tendon to diagnose the tendon ruptures. I have one patient called Dr. Kulkarni sir. He met with accident, trauma case it was, and I have diagnosed complete supraspinatus tear on ultrasound itself, no need of MRI, and he got operated and his shoulder replacement was done. So such the case, it was referred by Dr. Dhamne sir, his suspected case of Achilles tendon rupture, history of trauma. So the ultrasound, on ultrasound only I have given, there is a complete disruption of the Achilles tendon with, there is a hematoma formation and the collection that, so this was a diagnosis of full thickness tear with bulky retracted tendon and calcification that is suggestive of tendinitis. So 23 week scan, no previous scan were done. This is a classical case of, anyone? Yes, it is a classical case of anencephaly, and the sign is known as frog's eye sign. We can appreciate there is a no skull only. This is a herniation of brain parenchyma. याच्यामध्ये आपल्याला स्कल अजिबात दिसत नाही आहे आणि ब्रेनचं पॅरेन्कामा हर्निएट होतं आहे. हे जे काळं दिसतं ते amniotic फ्लुइड आहे. सो दिस इज अ usefulness of 3D 4D and the confirmation of the same. There is no skull and the brain tissue is getting herniated. So this is frog eye appearance. These are both are the orbits. This is a image which shows anencephaly, and this is postpartum case of fetus which is showing anencephaly, and these are the few other cases of anencephaly only which was not diagnosed on ultrasound. So frog eye anencephaly. So again the soft tissue. In this case, this guy came with the trauma and his knee joint was swollen and there was swelling on the lateral aspect. So here we can see there is a rupture of lateral collateral ligament and there is a collection that is hemarthrosis, and the same case referred to MRI and the diagnosis was the same. So this is a classical example of a small VSD. As I discussed, 2.1 mm VSD was diagnosed on my machine, and it was possible only because of the high-end advanced machine. This is also, sir, a rare case. This is 8 months scan. This whatever we are seeing, this is the baby's cheek, and it is the mass which is showing the vascularity on color Doppler study, and this mass is a hemangioma. You can see the nostrils, and this cheek is normal, and this cheek is showing a mass, and that turned out to be a congenital hemangioma only after birth. So I have taken the follow-up of the same case. And 22-year female, 15 days back D&C was done, UPT is negative. So in this case again I have done TVS, and this is a logic P6 machine, and in this case we can see that there are multiple serpentine vessels which is showing marked vascularity. This is a case of AVM. So this was also a classic case. In this case we can see there is no pericallosal artery. So the corpus callosum in this case was absent. So this was a case of, sir, agenesis of corpus callosum. So this is also a classic case of double bubble sign, duodenal atresia. So usually we see 6 fingers, but the post-axial polydactyl is very much common, as Ritik Roshan was having the 6 digit, but the pre-axial thumb side extra finger is very much rare or uncommon, and that was diagnosed by me. And this is the case where the 6 finger we can appreciate from the thumb side. These are the 5 fingers and this is the extra finger. That is, this case is known as pre-axial polydactyly. And this is a classic case of Binder syndrome. We can appreciate there is a flat nose, then the low set ears, abnormal facies. This is a case of, in this case we can see the flattening of nasal bone, and the chin, the retrograde chin is small in this case, mandible is small. So this was a rare case, Binder facies syndrome, teacher colon syndrome. So this is Down. This is what this case I was discussing, sir. Down syndrome. At 18 weeks, TIFA scan was done. The baby face on 3D it looks normal, but when I screened heart, there was a AVSD, both atrioventricular septal defect, and then in this case also we can appreciate there is a AVSD, and same baby was having hypoplastic nasal bone on one side and other side have complete absent of nasal bone. So this was a case of, I have given this as ostium primum AVSD with hypoplastic nasal bone and raised the doubt of T21, that is Down syndrome, and amniocentesis was done, and this turned out to be a Down syndrome, and the patient is very close a friend of mine. There are so many cases, but I'll skip. This is one more case. I have done a case, 21-year female, consanguineous marriage, already previous baby had some abnormality. I have scanned twice on 18th and 21st March of 2020, several times, and the findings was persistent. There was a club hand, and this hand we can appreciate, there is a club hand and one bone was very short. So this is a hand, this is club hand and single umbilical artery. We have to see the 3 vessels in the umbilical cord, that is known as Mickey Mouse sign, but Mickey Mouse sign was absent in this case, and only we can appreciate the 2 vessels, that is single umbilical artery. And in this case, the same case on Doppler study, single umbilical artery, and the hand abnormal, club hand with radius hypoplastic. This was seen that there is a medial rotation likely due to the radial ray anomaly or the hypoplasia of radius. So this was a radial ray anomaly case, which is also a rare case, sir. So this is also an interesting case, CDH. In this case we can see this is a gallbladder. The heart got shifted to the opposite side. The stomach bubble, the bowel loops are in the left hemithorax, and the heart mediastinal shift to right. This is case of congenital diaphragmatic hernia, which I have diagnosed. So many cases of hernias I have diagnosed antenatally on TIFA scans. So this is another case where we can appreciate the abnormal hand. Okay, this is a case of club hand, and same the bowel loops, stomach bubble getting herniated into the thorax. The hand is club hand, and we can see this is a urinary bladder, and this keyhole appearance, it is classical of posterior urethral wall. And in this case, sir, this is a head actually. This is a occipital bone, and there is a defect in the occipital bone, herniation of brain, and meninges are seen. So this was also a syndromic baby, most probably a Turner baby. Another so encephalocele, diaphragmatic hernia, VSD, polydactyly, cleft lip, palate, and posterior urethral wall, and this was totally collective of a Turner syndrome. Next, 1.5 month child with projectile vomitings. This was case referred by Dr. Ramraj Shrihari sir, and the baby had a classical 3 signs. First time I have seen in my life, which is very difficult. CHPS diagnosis is difficult because babies, they do tend to cry, and we won't get a proper window. And in this case, baby was very, that time the proper feeding was given. This is stomach, and this is the pylorus, which is given, it looks like cervix. This is known as cervix sign. And the next sign, which is classical of target sign, the pylorus, which looks like target appearance, and the nipple sign. All 3 signs were positive in this case, and this was a classical case of a CHPS, pyloric stenosis, and the pyloric stenosis differential diagnosis is pylorospasm. So down babies, how the down babies look. Both are brothers, and both are down babies. The Down syndrome typical features will be there of Downs. This was a rare case. This Baba came with a frontal swelling. I have screened, and initially I thought it's only lipoma. But when I screened him again on my E6 machine, then I found something, the echogenic area within. This was a case of lipoma with fat necrosis. So this was a case of lipoma, fat necrosis. So I'll move to CT cases. We have last fetal case I'll discuss. So this was again a case, interesting case referred by Dr. Aarti ma'am. The 21 weeker. In this case, the one femur is very short. Again, the length 3.7 and 2.9. So this was shortening of right femoral bone with decreased femur and foot ratio, suggestive of skeletal dysplasia. This is a lethal type of skeletal dysplasia known as PFFD, proximal femoral focal deficiency or dysplasia. So these are the beautiful 3D images and how it looks post birth. So due to short femur, there is a short overall limb on the right side. This is another case of PFFD. So with advancement we can diagnose all these things, and there is now the advanced treatment. The limb lengthening treatment is there for the same case, but the success rate is not that great. Sir, one more rare case. There are 3 things. This is a brain. There is herniation of brain parenchyma, posterior encephalocele, and polydactyly. 6 fingers are there. All limbs had 6 fingers. Hands and foot 6 fingers. That is known as polydactyly. And echogenic polycystic kidneys. So polycystic kidneys, posterior encephalocele, polydactyly. 3 P's. That is the classic syndrome known as a Meckel-Gruber syndrome. Meckel-Gruber syndrome. So this is posterior encephalocele. Another case of posterior encephalocele, and we can appreciate a small defect in the posterior occipital lobe, and we can see the occipital encephalocele posteriorly. And this was another specimen which is showing the posterior encephalocele. The kidneys are polycystic and polydactyly, Meckel-Gruber syndrome. Coming to the CT interest, I will discuss only 3 to 4 cases. This is the first patient of our CT scan, and the patient was referred by the Dr. Mahesh Patwar sir. X-ray was done, chest PA view was taken by me, and there was a patch in the involving left mid zone, and the Baba was having hemoptysis. He was old age, loss of appetite, and weight loss. So I was suspecting a mass. I called sir. Sir also got convinced for CT scan. Patient also luckily got convinced. We have done at reasonable cost, and this patient, the CT scan has turned out to be a lung mass, and this was a case of lung cancer, that is adenocarcinoma of the lung, bronchogenic carcinoma. So this is a lung window case. So the first case on our CT machine was diagnosed as a lung cancer. Unfortunately, the videos are not working. So this was a bronchogenic carcinoma. The second case, very interesting. He is very close to our medical fraternity. He's a medical professional, paramedicos. He's having his medical shop in MUKHD. He is 37 years old. I came from Mumbai. I finished my law exams. That day it was a very busy day. It was Monday. And this guy came for digital X-ray, just saying that he is having cough since 8 to 10 years. Occasional cough, on and off. So I have diagnosed, and there is a non-homogeneous opacity in left lower lobe, and anyone will tell this is a consolidation. But this is not a consolidation. This is a case of congenital left diaphragmatic hernia. And this I was diagnosed, this was my first impression. I told my surgeon friend, Hyderabad, he was like, Arey, it is very rare. So this is a CT patient. We can appreciate the lung on right side and the entire bowel lobes on in the thorax, and we won't appreciate lung tissue on left hand side. The video is not working. So this is the demonstration how the lung will be getting compressed, the heart will be shifted, all the left hand side, the small intestine, large intestine, liver partially getting herniated into the diaphragm. So in this case, the entire thing, sir, on left side, stomach bubble, stomach, pancreas, spleen, and part of liver, everything was in the left thorax. And he has not diagnosed and he was not having any trauma history as well. So this CT scan was done and the same diagnosis was there. It was a left-sided diaphragmatic hernia. And in literature, there are only less than 100 cases worldwide. Congenital left adult Bogdalek hernia. It is known as Bogdalek hernia. So this is a classic TB case. Bilateral lung shows multiple fluffy infiltrates in both sides. This was a very young guy, Vishal, his name was, and he is just 22 years. So this was a case of, and again Dr. Pundesar referred one case of left cheek swelling for ultrasound neck, and I have given that as we have seen the stones at gallbladder, kidney stones, pancreatic duct stones, but this is a case of a stone in the Stenson duct, that is this is submandibular duct stone. Here we can appreciate the stone, and on ultrasound stone looks like this. This is a stone and which is giving a posterior shadowing. So the same diagnosis was given on a CT scan machine. And why it happens? Due to the various bacteria and viral infections, due to the due to lack of oral hygiene, and this is a impacted stone. We can see in the diagram. So these are the case is known as sialolithiasis, salivary duct, that is submandibular duct stones. So one last case I will take. This is, sir, a latest case. 2 days back only, the patient was referred to me by respected Punde sir. Whenever sir's patient come, I ask my fellows to take those patients like Kaurav sir patient, Punde sir patient, old age patients. I will screen them on E6 machine as well, because whenever the old age people, they have not done previous ultrasounds. Whenever there will be a major problem, they will come, and as age increases, there are chances of getting risk of CA increases, because in view of history of tobacco, chewing or alcohol and all. So this was a periampullary mass which was diagnosed by me on ultrasound recently, duodenal mass, and the patient was not convinced by me. I tried to convince, but he didn't convince. Then he went to sir, and sir, again that patient came in within 15-20 minutes back to me, sir, CT scan karna hai. So this is the convincing power which Kaurav sir, Punde sir, all seniors they have. We cannot convince all patients being a juniors. And this case, she was this was a case of same duodenal CA or periampullary carcinoma. So again, this 22-year female, cystic mass of the pancreas. This was also diagnosed on ultrasound, sir. This was a case also, case was referred by Punde sir only. And this cystic mass, pancreas, usually we see serous cyst adenoma, and most common 80% is pseudocyst pancreas. But this cyst, I was having a doubt, mucinous cystic neoplasm, which is only 5%. And I was having a strong suspicion, and I convinced respected sir as well as patient, and we managed to do the CT scan, and she was having that mass. The last case, she is my tenant, sir, at the JAM. Once I went to JAM and she was like, sir, I'm having burning sensation. And she consulted several times. Her chest X-ray was normal, ECG was normal, no abdominal complaints. I asked her, Kaku, please come tomorrow, I will screen abdomen. And when she came, we found a huge 9 centimeter mass in the RIF that is coming from the ileum. That was a bowel mass, and she was absolutely asymptomatic related to abdomen. So as Dr. respected Swami sir once told, abdomen is like a magic box. We can get anything in the abdomen, and this was her CT report. We convinced her for CT, and on charitable basis only we have done the case, and this was a case of the adenocarcinoma, and diagnosis DD was given lymphoma in CT scan, and this is a post-op specimen, and she was a poor lady. My mama, she helped her to get this surgery done, and this was a case of bowel adenocarcinoma. And the last case for the today, this case was referred by Dr. Kaurav sir. One 80-year male patient, he came with just epigastric pain. I screened him. This is a gallbladder and the common bile duct. Common bile duct was dilated, and there is a small suspicious mass. I called Dr. Kaurav sir. I told sir कि I am seeing sir 12 mm distal CBD mass, and which could be malignant, because the patient was old age and his the IHBDs were dilated mild. So that patient, sir has convinced that patient. We have done a CT scan, and it turned out to be a periampullary, a small periampullary carcinoma. So I have taken much time, I guess. Yes, sir. It is last slide, sir. So my sincere and deep gratitude to all my respected doctors. I'd like to express my special thanks of gratitude to respected Dr. Dilip Punde sir, and thanks to all my ADC staff. Thank you, sir. Thank you very much.